Medico Marketing, and I welcome you all to We Talk Do You, a show by Puberty to Menopause, a public health awareness initiative by Human Biological Institute. Human Biological Institute. Human Biologicals Limited is an initiative of Indian Immunological Limited. IL was established by National Dairy Development Board in 1982, and its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. HBI was established in the year 1998 with the Government of India requested IL to produce modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing faculty of HBI was established at Uti. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are the major player in human vaccines. Leader in our ARV segment and present in around 60 countries. 3 state-of-art manufacturing facilities are Uti, Gachibowli and Karkapatla, that is in Genome Valley. HBI has forayed into market of clinically proven wellness products and infertility range of hormones. Our vision is shaping global healthcare by spearheading to One Health initiative. And our mission is to innovate, produce, and market quality healthcare products and service to improve and extend lives. We believe in providing affordable products at high quality through continuous technical innovations and improvements to meet our customer need. We believe in providing affordable products and high quality through continuous technical innovations and improvements to meet our customer need. That is our vision. As a market leader, we have taken a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly packs for our leadership brand Abhairab and Abhairab PF. As a corporate social responsibility, we have adopted schools where IL is providing infrastructure and basic facilities, including in helping midday meal program. In association with NDDP through our gift milk program, hundreds of school-going children are benefited daily. We also have donated oxygen generation plant to Telangana Institute of Medical Science, Gachibowli, during the COVID time. These are the few information about IL. For more information, you can also log on to www.indieimmune.com. Puberty to Menopause is yet another initiative of HBI, where we talk about everything and anything about women's health. Today, we talk Do You. Show is dedicated to yet another very important topic, practice essentials to reduce the risk of preterm by Dr. Seema Mahajan. Hello, ma'am. Welcome to We Talk Do You. To understand more about this, debunk certain factors of preterm, we welcome Dr. G. Seema Mahajan, MBBS, MS Obstetrics and Gynecology, having a wide range of clinical experience since many years and with vast experience currently working at Jeevan Jyoti Surgical Center and Nursing Home, Indira Nagar, Lucknow. Let's welcome ma'am. Hello, ma'am.
Good afternoon, Dr. Shravani and the whole team. It's indeed a pleasure to have a talk with you all. So let's start the show.
Yes, ma'am.
Just pardon me, I have a bad cough. So if anything I cough in between, please do pardon
Ma'am,
me.
your presence is at most, very important. In your busy time, you're taking time for us,
Yeah,
women of India. Like whole country women are watching this.
yeah,
Thank you for
definitely.
this.
Thanks a
Most
lot.
welcome, ma'am. Thank you so much for being us with on We Talk Do You show. Let's start the show with some common queries and questions related to preterm. Ma'am, what is preterm birth, and what are the different types of preterm birth?
Any baby which is born before 37 weeks of gestation is called as premature birth or preterm birth. Now, to classify preterm birth, we divide it according to the gestational age at which the baby is born. Now, suppose the baby is born before 28 weeks, or the baby is born between 28 to 32 weeks, or between 32 to 37 weeks. If the baby is born before 28 weeks, that means the baby is extremely premature, and we call that group as extremely premature group. If the baby is born between 32 to 30, 28 to 32 weeks, then the baby is in the group of early preterm group. And if the baby is born after 32 weeks and less than 37 weeks, then it is late preterm. So, according to the gestational age at what weeks the baby is born, this preterm birth is divided.
Okay, ma'am. As you mentioned, the stages of the preterm. Ma'am, how common is the preterm
Yeah.
birth?
Uh, yes, it is common. It complicates around 10 to 15% of all the pregnancies. So it is a big chunk, and we have to think over it and have to manage it effectively. Because preterm delivery babies also they have a lot of complications. So this problem has to be tackled. It is not very less. It complicates around 10 to 15% of women.
10 to 15%. It's a large number.
Yeah,
Ma'am,
it's a large.
what are the factors that cause preterm birth, ma'am?
Yeah,
What are the common
yeah.
factors? What are the risk factors? And why this woman get into preterm labor or birth?
Yeah, very true. The causes of preterm birth could be either fetal, placental, or the uterine causes, or any maternal cause. So we divide these into four parts. Number one, the fetal part. In the fetal, suppose the woman is having multiple pregnancies. So these women are, I mean, because of the over distension of the uterus, the baby delivers earlier. So it is a cause of preterm birth. Suppose there is IUD, intrauterine death, or any congenital malformation in the fetus, then also it leads to preterm birth. Now, the second thing is the placental causes. If there is placental abruption, like the placenta separates from the lining of the uterus, then also it leads to preterm birth. And or if there is a case of placenta previa, means the placenta is situated near the cervix, near the lower part of the uterus, then also it causes preterm birth. Now, coming to the uterine causes, if there is any uterine anomaly in the uterus, it causes preterm birth. And the next very important thing is cervical incompetence. Women who have a shortened cervix that is less than 25 mm have a greater chance, or they it leads to preterm birth. So the cervical shortening or decrease in the cervical length is a very important cause of preterm birth. Now, coming to the maternal causes, women who have chronic diseases like chronic hypertension, gestational diabetes mellitus, preeclampsia, any renal cause like bacteriuria or cystitis or pyelonephritis, these diseases lead to preterm birth. Even women who have asthma, they are also positive features of preterm birth. Women who have periodontal disease, we during pregnancy, it is very important that we tell these women that taking care of their gums is also important. gums and teeth, because that could be also a factor for causative factor for preterm birth. So these are the factors which lead to preterm birth.
Very well explained, ma'am. And there's a new thing that
Yeah, yeah,
dental issues
definitely.
also can cause.
Yes, it is a very important thing, and it has been seen as a cause of preterm birth.
Very interesting, ma'am. Ma'am, there's a common query that,
Yeah.
like, if the first baby is born with the preterm, and in the subsequent births also can cause a preterm.
Yes, there are 1.5 to 2 times more chances of the women landing in preterm labor in the preterm birth in the second pregnancy if there has been a past history of preterm birth. So these are the risk factors. There are many risk factors also which are associated with preterm birth. Those factors we'll discuss also, and we have to look into it.
Yes, ma'am. Ma'am, what are the health complications of being born preterm
The
or
health
premature?
complications, yeah, the health complications which are problematic are, or which causes problem, is because of the prematurity. All the organs of the baby are premature, so the problems arise because of the immaturity of the organs. Now, suppose the baby is born premature, before term, means the baby. Most important thing is the weight of the baby will be less. Yeah, the next thing is, on seeing the baby, you'll see the head is a bit bigger as compared to the body. Number third, the plantar creases, or there is absence of creases over the feet. There's scanty hairs over the body. Then there is, the baby has difficulty in breathing. Suppose the
Yes.
baby delivers, so what happens is there are phases of apnea, or the baby stops breathing. So these are the things which we have to look into it, so that, or we have to shift the baby usually monitored in the intensive care unit. That is why, because we have to tackle all this immature, all these organs which are immature, and we have to see. Now, there are other risk factors also. What is most important in preterm birth? We have to look into the risk factors. As doctor, as a medical professional, we should also look if the woman is coming for antenatal checkup, whether she is a candidate high risk case for preterm birth. So these, if we tackle or check these risk factors, we can manage these cases well, and we can prolong the pregnancy at the right age. So the risk factors, which are, number one, the age of the patient. If the lady is less than 20 years or more than 40 years, she has a risk factor for preterm birth. Number one, as you already said, if the lady has a history of preterm birth in the previous pregnancy, yes, she has a 1.5 to 2 times more chances of preterm birth in this pregnancy. So we have to manage accordingly. Number third is multiple induced abortions. If a lady has a history of multiple abortions in the past, she is a candidate who can land in preterm delivery in the running pregnancy. Now, women who have short interpregnancy intervals, they are also, they have a risk for having preterm birth. Again, any history of vaginal bleeding in the first, after the first trimester, is a risk factor. And the another thing is the obesity, or women who are obese, overweight, they have a very high risk factor for preterm birth. These days we see a lot of IVF pregnancies. These women also have, they have a risk for preterm birth. Multiple pregnancies, as I have already said. And the third and the last thing is, these days we see women smoking, alcohol use. Smoking again has a very big risk factor for preterm pregnancy. So we should inquire these women and see whether they have these things, and also if she has any urinary tract infection, genital tract infection, or any maternal infection, which we will inquire during the antenatal visit. So we will see or mark in our this thing in our OPD prescription or anything, that she is a risk factor, and we have to monitor her closely and so that we can prolong this pregnancy and this pregnancy has a good outcome.
Okay, ma'am, explained so well explained. Ma'am, like, do all the preterm births end up in the ICU? Like,
Yes, not all preterm births. If the baby, suppose the baby delivers at around 36 weeks, and the pediatrician sees he or she is good, the sucking is normal, the baby is normal. So no, it is not required. It's just an observation of a couple of hours, and the baby is shifted to the mother because bonding with the mother is also important.
yes,
So
yes,
it depends on how premature the baby is. Suppose a baby is born at 28 weeks, yes, she or he, the baby definitely requires an ICU, even though in the first hour, or suppose you feel it is all right. No, because the signs of apnea and all, they may come later. So monitoring
yes.
depends on the age of delivery, age of gestation at which the baby is born.
Okay, ma'am. Ma'am, what is the management and treatment for to avoid preterm delivery?
Number one, when the women comes with preterm, I mean preterm birth, women usually have dull ache or any menstrual like cramps or anything. What is most important is we do a physical examination, check her vitals. Most important is we have to see whether she's having any temperature or not. If the woman is having temperature, that means is there any infection anywhere in the genital tract, or her membranes have ruptured, or there is any other signs of chorioamnionitis. So we have to see. And the most important thing is we have to assess her gestational age, because sometimes the women, they forget their gestational age, I mean the correct period. So we assess by per abdominal examination, by her previous ultrasound scans, and see what is the correct gestational age. Then we see per abdominally also, and see what is the age. We do a per vaginal examination to see whether there is any associated leaking or bleeding. And accordingly, the most important first thing is we admit the patient and we reassure the patient, allay her anxiety, and then we start tocolytics. Tocolytics are medicines which are given to stop the uterine contractions which the lady is having. Now, if the ladies, we give tocolytics so that we can prolong the pregnancy, and these uterine contractions which are occurring, they subside, so that the pregnancy continues. Now, there are certain contraindications to tocolytic drugs. If the women, there are uh, features of chorioamnitis, there is infection in the urinary tract, in the genital tract, we don't give. If the cervical dilatation is more than 4 centimeter, then also we don't give.
Okay,
Then you give antenatal steroids, corticosteroids to the patient, so that if we have time, there is a little amount of lung maturity the baby can attain. These are the things. Antibiotics are required if the lady has infection, and we monitor the case side by side. We prepare, if we are at a lower center, we make provisions that the lady moves to a higher tertiary center where there are of where there is a neonatal intensive care unit, and the problem of prematurity can be tackled easily.
okay, ma'am. Thank you. Ma'am, usually women think taking something like antibiotics or
Yeah.
hormones or steroids during pregnancy is bad for the baby. So,
Mm.
how do you debunk this myth to the common women?
No, no, it is not corticosteroids. I mean, we don't give continuous. There are only two shots which have to be given, and that has to be given under a gynecologist supervision. So it does not cause any harm. We have to outweigh the risk and the gain. So it
Yes.
doesn't cause any harm. On the contrary, it causes a lot of benefit. And antibiotics are given only if there are chances of, I mean, if there's signs of infection like premature rupture of membranes, anything which is, or anything that is life threatening to the women, we have to save the mother first. That is there. But these are not at all harmful to the baby.
Okay,
Okay.
ma'am. Like, very well said that something, the treatment is more important than the myths. Thank you.
Yeah, yeah, definitely. And the next thing is now the mothers also having the women who is giving birth to a preterm child has lot of she faces lot of uh, anxiety, depression. This is again very
Yes.
common in these women. So that part, the mental health of the women has to also be taken care of. The women could suffer from anxiety, postpartum depression, and post traumatic stress disorder also the women can have. Now the post these I mean, why does the woman have a postpartum depression? Because the woman is emotionally, she's challenged, she is under stress that she's going to deliver a preterm baby and it's going to cost a lot. And what is going to happen, she also knows, because many I mean, the women are quite literate these days. So there is something goes in her back of her mind, and so the emotional and the physical challenges of carrying a preterm infant increases the risk of postpartum depression. There could be bonding difficulties also in the mother, because each time the baby is admitted in the ICU and there
Yes.
is stressful circumstance, so there are difficulties in bonding. Mother is also at risk of infections, so that thing is also there. And because most of these women have concurrent illness like chronic hypertension, renal disorders, gestational diabetes, so we have to take care of those things also, and these things also impose health risk to the mother.
Yes, ma'am. Very well said, ma'am. Like women think that when my child is born preterm, so he or she will face lifelong struggles with the immunity and all. Is it true, ma'am?
Uh, yes, there are certain, yeah. As I earlier said, the problem with prematurity is because the organs are immature. God has given us given human beings 40 weeks of gestation because the organs, they grow and they are mature so that the baby can survive without any external help on its own when he or she comes in this world. So any baby who is born premature because of the immaturity of the organs will have those problems. Number one, what problems will the baby have if he or she delivers preterm? Number one is respiration. The baby can't breathe properly. So the baby will have respiratory distress syndrome. The GIT problem is the baby will have necrotizing enterocolitis. In the brain, the baby can have intraventricular hemorrhage. Then, most important is retinopathy of the prematurity, eyes. Yes, there is problem. Again, there could be metabolic problems like hypocalcemia, hypoglycemia, and even hypothermia because the baby cannot maintain the temperature on its own. So these are the immediate complications for which the baby is admitted in the ICU, and the outcomes are very good. We have seen babies who have born preterm between 30, 32, 32, and they have uh, come out very good after the management by the competent pediatricians, and they have come out from the ICU and they are doing well. But yes, there are certain complications which have to be tackled, and there are certain mishaps also. Now, the long term complications could be, yes, there have been studies which literature tells that there could be mental retardation, cerebral palsy, chronic lung disease, vision and hearing loss, and even poor neurodevelopmental outcomes also. So that is why we have to tackle this problem of preterm birth very carefully, both by the patient and the doctor. Hand in hand, they should go. So this problem can be tackled efficiently.
Thank you, ma'am. Thank you for explaining so well health risks. What are the health risks when the baby is born in the preterm,
Yeah, yeah,
and how
definitely.
what all the pregnant woman poses,
Yeah,
ma'am. As you said, as you mentioned, psychological way to be strong is very much important. With that, can you just give us small tips during a pregnancy, like a nutrition and lifestyle, what the woman should keep in mind from the beginning to the end of her trimesters?
yeah, yeah. That is very, very important. Very good question you have asked, Dr. Shravani. Number one is the most important thing is the prenatal care. What happens is we when the women becomes pregnant, then only she goes to the doctor. I mean, this is prevalent in our society. But what is most important is the prenatal care. If before embarking on pregnancy, if prenatally we see that we are fit to carry that pregnancy, I mean, it's very, very important. So the treatment or the for me, I think the treatment should start in the prenatal period as such. And what we have to tackle, because the risk factors, we can catch hold of all those risk factors. Number one, if the women is not overweight, she can tackle that thing. She can optimize her weight. That is very, very important. If she has, I mean, she's smoker or she's alcoholic, she should be counseled that if you are going to do this, you will land in problem. Next is a healthy lifestyle is always good. Like a good diet, good balanced diet does wonders and is always good. You stay fit, you do these reduce your stress levels, it's again good. And the next thing which is most important is the woman has to be checked for the sugar levels. If she is a diabetic, before embarking on pregnancy, her HB1AC level should be in the normal range, because these women are the women who land in abortions and preterm births. If the lady is having chronic hypertension, she should check it that it is in the normal range. So prenatal is of utmost importance to reduce. We can reduce preterm birth to about, I think I can reduce it to 40-50% if the prenatal care is taken care of.
Okay, ma'am. Thank you. Ma'am, we like what are the three takeaways from this interview? It's a very interactive interview. We have
Mhm.
been asking like so many questions. We are really having a lot of fun. Can you please give us three takeaways from this interview, ma'am?
Yeah, the most important thing is the takeaways, I think, is number one is the prediction. If we can predict that this lady is having, prediction is the most important thing in prevention of preterm labor. If I can predict this lady is going to have preterm, so all the things which I can do beforehand will go is going to help her a lot. So already one you have said is the prenatal care. Like before embarking on pregnancy, I have to think about it. If I have those risk factors, I will control those things. Smoking, you have already said. Weight gain, weight control is number one. I should plan my pregnancy. That is, pregnancy spacing between births is also very important. I mean, it is not that I had one baby right now and next time I'm having after one. Spacing between births also, number one, you have the mother has adequate nutrition, she is also fit, and the baby she's carrying will be also fit and will not land in preterm. Number two. Number three is, as I already told you, that stress levels, a healthy diet, this is already always there, everybody tells. And if I have any concurrent illness, that should be monitored. Number second is the takeaways in preventing this preterm birth is patient education. As a doctor, if the patient comes to me, I have to see whether she has those risk factors. I will, if she is a case of she's having those risk factors, I will take more time to teach her or tell her what are the symptoms for which she should report to me, and mm, so that these things can be stopped. Like if she's a case of preterm labor in the past pregnancy, I'll tell any amount of pain if you have in the lower abdomen, or any menstrual like cramps, any discharge, or anything which is deviating from the normal, any pain which is persistent, please do report to us beforehand. I mean, report to us, don't wait, because that phase period is gone if we wait for long and remain at home. The time of giving the medication and the medication to work, that finishes, and that the lady lands in the preterm delivery. So patient education is very important. Our adequate antenatal care is very important, and the pre-pregnancy is always, the prenatal care is very important. So it is a joint effort of both the health provider, gynecologist as such, and the patient education and the patient, which will jointly help in uh, um, promoting a normal term delivery.
Thank you, ma'am. Ma'am, this is a world of social media. Every woman has a doubt.
Yeah,
They just go to Google and they just Google everything.
yeah, yeah.
Like, what is your suggestion to the modern woman who
No, no,
Google
that is what.
everything?
Yeah, yeah, definitely. I belong to that era where there was less of internet and less of Google. These days, I mean, there is a new disease which is Google pathy. So many women, especially in two-tier of first-tier cities, they come, they already go through the net. So I would request these girls have less of Googling, please. Have faith on the doctor and also on the women in your house who are elder to you, like your mother-in-law, and don't Google a lot, because there are a lot of things for I mean, if you Google for a simple fever, they will land you into malignancy, so that is
Yes.
not required. I mean, less of Google searching and more on relying on your doctor and your family members, and having adequate rest, sleep, and enjoying your pregnancy. Pregnancy is not a disease, okay?
Yes.
There are certain physiological changes which happen. So you
Yes.
have to enjoy your motherhood and have faith on the doctor and all the almighty above, and everything good is going to happen.
So true. So well said, ma'am. Thank you so much. Thank you, Seema ma'am. Thank you so much that you joined us today and said you gave an very good information regarding preterm birth and delivery. And we are so thank you for this, for giving your precious time, stopping patience and giving some time to like women of India. Thank you.
Thank you.
I'm sure that whosoever is watching this video and would be watching this in future will definitely be get benefited with all the suggestions and insights given us today. Thank you for so much
Thank
for joining us
Thank you,
today.
Dr. Shravani, for this beautiful, wonderful talk. It was pleasure is all mine. Thank you.
Thank you, ma'am. Thank you. Today, I was a pleasure hosting you today in We Talk to You. With this, I would like to request all the viewers to follow us on Puberty to Menopause in all social media platforms. And if you feel us and want us to reach out with kinds of posts, please do write us on pubertytomenopause.com. We will come to you with more series with leading healthcare experts of our country. Thank you so much for joining us today. Thank you so much, Dr. Seema, ma'am.
Thank you. Thanks a lot.